Healthcare systems across the state are expected to receive $840 million in aid from the federal government because of the broader impact of the coronavirus pandemic. Berkshire Health Systems slice, $15 million. But the Berkshire Eagle reported that BHS expects a $13 million loss for the month of March and up to a $25 million loss in April. Dr. James Lederer is Berkshire Health Systems Chief Medical Officer and Chief Quality Officer, and he spoke with me about the projected deficits short of monthly federal help. I asked him what changes BHS will need to make in order to survive.
We're fortunate in that while those funds that have been distributed thus far, come at the right time, and they certainly don't meet the need, there will be other funds associated with the COVID virus, outbreak. Many of the Medicaid and Medicare folks who are affected by COVID will have an enhanced payment if that is documented on their electronic medical record and the billing submissions that we send to Medicare and Medicaid. So it's not a complete lost cause, and we expect there will be other federal disbursements over the course of time. So we Berkshires are like many other health systems across the country. It's always been that there is a savings account that the Berkshires have, and it's sometimes what we need to do is to reach into that savings account to fund the ongoing business so that we can continue to provide care to our community. So I think, obviously there'll be some attempts to really fine-tune our processes and improve our, distribution of care and look at our resources and our purchases and the things we do, after the COVID virus is over to try and be more fiscally responsible. But at the end of the day, this may be something that, we, like many healthcare organizations, will have to endure.
You spoke a moment ago about resources. Recently, Governor Charlie Baker came out and said that he's going to ease some of the licensing restrictions for foreign educated medical workers. I know historically that the Berkshires has had a shortage of doctors specifically. Do you think that the easing of that licensure is going to help in the Berkshires?
I'm not sure. I think, the Berkshires is an area of Massachusetts that is beautiful, beyond compare, and I think it attracts a certain kind of person, but it's also, a little remote, and it's a little small, and so, we don't have the nightlife of, say, a Boston, but Boston doesn't have the beautiful, countryside and outdoors that we do. So I don't know that easing that licensing restriction will change people's perspective. I think we just want to build, a strong medical group, have a strong healthcare system, and I think that's where we will attract highly competent and engaged physicians, to continue the care and really to grow our outreach to the communities around us.
That's city mouse versus country mouse tug that I know well as a former Berkshire County resident. I want to pivot and talk about the numbers that are coming out of the Department of Public Health related specifically to COVID-19. As of yesterday, 355 cases total reported in the Berkshires. When you and I spoke about 2 weeks ago, there were about 75 cases that had been reported, and you told us maybe 11 or so of those folks were ill enough to need to be in care, being hospitalized. What are you looking at right now for a number of people who you're treating in your hospital system?
So for perhaps the last 8 to 10 days, we've had on average about 20 to 25 admitted patients to the general medical floors. And in the intensive care unit, we've actually seen a slight downturn. Right now we have 5 COVID positive patients who are on ventilators in the intensive care unit. So our total COVID numbers are somewhere right now at around 28, and that's much decreased. Fortunately, because we now have an on-site testing platform for the COVID virus that allows us to do turnarounds within 45 minutes. Now, we don't have all the supplies we would like to have for that testing, and over the next 2 weeks we'll see it ramp up significantly, but it has been a godsend to be able to look at a recently admitted patient from the emergency department and know whether or not that they are COVID positive or negative, so that we can, better place them in the COVID care units that are appropriate for them. And by the same token, we still are challenged with our PPE, and if we overutilize it on patients who don't need it, then we'll burn through that much faster.
When you say, just to be specific, when you say expecting a ramp up in the next 2 weeks, do you mean of the number of testing supplies you have available or a number of patients?
The number of testing supplies we have available. As we get more supplies and can manage the inpatient volume with that quick turnaround, the other supplies that we've been using for our referral lab with Quest, we hope to ramp up that capability for the community through our drive-through as well.
When we were talking about cases of COVID-19, we've been hearing so much about the surge, that peak in cases that are expected in Massachusetts. Governor Baker has said that he expected, based on models that the governor's office was looking at, is that we would be experiencing that now. However, in Western Massachusetts, we've heard different information, specifically coming out of Bay State Health Systems in this region, and some questions about whether or not the surge would be a little later. Based on what we heard last night from a different Bay State official, they think now maybe we could be experiencing that peak. Based on the numbers that you have for Berkshire County, where do you think you fall on that?
So if you remember, Berkshire Health System had its first admission February 29th. And so we've been at this now almost 6 weeks. And I think in those early days, the Berkshire community and the leadership of Pittsfield and the surrounding areas, they started to advise us and put into place through the Department of Public Health, that social distancing, advisory, and then attempts early on to really help us manage, our exposures. And so I think because we had that aggressive approach early, because we are definitely not a population-dense community, and because of the rest of the work that, the governor has done subsequent, to our first cases, I think, and I'm being hopeful, I think that we have seen our peak, and now we're just going to see a general kind of flattened curve, if you will, or just a flattened number of patients coming to us day over day. It may be that 23 is our normal number of COVID-positive patients, for every 2 that are admitted, 2 get discharged. And so I think we may see that, but certainly it's not the kind of surge that was projected for, say, Boston and the city proper. I think that these models don't take into account population density. And I think everything I've seen across the country, when you look at different areas, and particularly when you see the flattening that's occurring in New York City, I think population density makes every difference in the world. And in those areas, who address it quickly and aggressively, like New York has done, we see the flattening immediately. And we've done the similar thing here in Berkshire County and are much less population dense. So I think on the whole, we're in good standing. And I don't know that we will see a surge per se, but if I had a concern, it would be the number of nursing homes that are now experiencing outbreaks within their facilities. And that's, that could be 50 to 75 patients coming out of any given home. And so I think we just need to be prepared to continue to support our nursing home and our care homes within Berkshire County.
I was actually just about to ask about that, given that we know that at least 2 of the facilities under Berkshire Health Systems cares have had those COVID-19 outbreaks in those facilities. Are you confident right now that those outbreaks have been contained?
I am. I think the work of the medical directors and of the clinical staff and the nursing staff has been just Herculean in their efforts to manage their patients, to cohort their patients, to make sure that the folks who are COVID negative are separated from the COVID positive units. And it does mean some shuffling of patients. And remember, these nursing homes are the patients' homes. And so it's very disruptive, but we do it in the hopes that if we can protect the overall facility and continue to manage the patients, that ultimately they'll get their homes back as they remember them, and will have been protected in doing so.
Given what you've told us about the number of cases you've seen, that you are seeing, where you think Berkshire County is positioned in this overall health pandemic, what would you say to the public about social distancing measures and whether they should maintain them?
Oh, I think they are the reason that that Berkshire County has done so well. Having really been the first case of hospitalized COVID in Massachusetts. And remember, back in March 1st, I think the U.S. count for total COVID patients was 83. And so we've come an incredible way in just these few weeks from there. And I would say that the reason the Berkshires are doing well are because we're not population dense, and that people have been listening to and adhering to the social distancing requests that our leadership has put out.